Good evening, everyone, and welcome to the 1914th uninterrupted webinar series of the International Forum for Promoting Homeopathy. I am Arya. I'm a third year student at Adarashramam NSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. And today we have with us Dr. Bhuvaneshwari. She's a distinguished clinician whose homeopathic journey began at the prestigious Government Homeopathic Medical College, Tirumangalam, Madurai in 2007. With exceptional diagnostic acumen and a deep passion for holistic healing, she founded Adi Isha Holistic Homeo Clinic in 2015, serving the Chengalpattu, Chennai region with dedication and compassion. And today, she will enlighten us on the topic Navigating SIMILIMUM, Real World Organon of Medicine, Insights from Clinical Practice. We are about to dive into a session that beautifully bridges organon philosophy with real world clinical experience. Welcome, ma'am, and the dais is all yours. Dr. Bhuvaneshwari, ma'am. Yes, ma'am.
Am I audible?
Yes, ma'am. Yes, you are audible.
Good evening, all. Good evening. Thank you for a wonderful opportunity again. Today's topic is Navigating SIMILIMUM, Real World Organon of Medicine, Insights from my Clinical Desk. Actually, today I want to enlighten the topic first because this is my most favorite topic because organon is the only reason for me. It is a boon to me to choose the classical pathway in homeopathy and also more passionate towards homeopathy. So I choose this topic. The main aim of this topic is that bridging philosophy and practice for optimal results. That is, we should not do trial and error, whatever the case, irrespective of acute or chronic. The selection of the SIMILIMUM is the first compass to find out the root cause of the disease along with the consideration of the totality of symptoms framing. Half of the case can be evaluated and can be resolved by proper evaluation of symptoms rather than selection of SIMILIMUM. The objectives of today's topic is to learn to correlate the disease symptoms and the personality symptoms. That is, matching the clinico-pathological symptoms and understanding the personality as well as constitution in the case of chronic diseases and also always connecting with miasmatic analysis. The enhanced case taking, as I already told, that resolves the half of the case to choose the SIMILIMUM. Understanding the remedy choices by matching with the personality either in acute or chronic holds the remedy selection in a better aspect which helps to heal the person permanently as well as gently. According to Hahnemann's Organon of Medicine, in his first aphorism, he wants to navigate and he has given us with the timeline compass which is useful till today. Almost the first aphorism and the second aphorism is a compass to frame the totality as well as to find the SIMILIMUM. The highest ideal of cure, rapid, gentle and permanent restoration of health, connecting the Hahnemann's mission to modern patient expectations with ethical practice by avoiding polypharmacy, mixopathy, or too much of patents. Hahnemann's The Law of Similia, Similia Similibus Curenta, stands as the cornerstone for the clinical practice in homeopathy with ethical ways. Let legs be treated by legs. As example, in general, in our routine, if we peel an onion peel, there will be watering of eyes. Similarly, in homeopathy, ipecac, when it is given in crude form, induces nausea. when it is triturated in homeopathic form, cures nausea. So this is the ground principle of homeopathy to arrive the simillimum and to restore the patient's health with gentle, rapid and harmonious healing. This evidence of the principle based completely to match the modern pharmacology with unbounded rebound effects. Homeopathy stands for its efficacy on its own. The art of case analysis in clinical practice more than just symptoms. Treating the patient by selecting the simillimum in an holistic approach by framing the totality, instead choosing the specifics using the medicine label. From aphorism 83 to 103, Hahnemann enlightened the importance of comprehending the patient as a whole, including the evaluation of illness as well as causative factors, integrating the bio, psycho, social, model symptoms expressed outside the patient's through modern case histories helps the physician and ease the selection of simillimum as well as the need of repetition of doses, and it acts as a compass to select the potency as well as simillimum. After framing the totality of symptoms, there lies the symptom analysis and evaluation. That is, differentiating the actual real disease symptoms from idiosyncrasy. What is idiosyncrasy? It is almost a state of dysfunction, a state of illness, as if mimic like a disease which gets recovered completely with or without medicine. That is the state of idiosyncrasy. For example, when a patient develops or any healthy individual develops nausea or migraine due to strong aromatic odors like fragrances or unpleasant odor that can be sustained and recovered back without medicine by avoiding the aromatic odors and lying down in a still and silent place helps to recover back. This is the idiosyncratic state. Similarly, there is a state of indisposition where again the person or healthy individual mimics like a disease. This indisposition state correlated with the stillness of healthy individual into the transformation of disease individual due to certain environmental triggering factors like continuous sneezing due to change of weather or exposure to pollen creates the runny nose and sinusitis or rhinitis symptoms, or related with some excess eating or eating stale foods leads to nausea, vomiting or diarrhea, which can be recovered back. Sometimes the need of remedy, sometimes most of the times there is no need of remedy. That is the indisposition state. So what is actual disease state? The patient can't able to recover back from the disease state to the healthy state until unless then the proper chosen simillimum, that is the actual disease state, where the Hahnemann point out with the framing the totality, giving more importance to the root cause of the disease ailments from irrespective of acute or chronic cases. In chronic cases, ailments from stands the highlighting feature form the first symptom to frame the totality and helps the guidance for selection of simillimum, and also in acutes the ailments from that is causative factor rather than the triggering factor. Triggering factor difference, that is maintaining cause. Causative factor is entirely different from maintaining cause. Maintaining cause always stands for the physical environmental trigger, where the actual causative factors, that is the exciting cause of the disease, stands from the mental indisposition, the disturbance in the mental emotions connected with sudden grief, disappointment, or brooding. So, the totality of the symptoms in a patient gives the actual marker for the selection of SIMILIMUM. It acts as a excuse me, I have water. Thank you. First, before selection of SIMILIMUM or before framing the totality of symptoms, the physician should understand and differentiate what is actual disease symptom, what is symptom created artificially due to overusage of the drug in any system of medicine, or whether it is a fake mimicking disease pattern in the state of idiosyncrasy or indisposition. The understanding health and diseases act as a blueprint for the physician to select the proper potency, proper remedy, and proper repetition, choosing the maintaining the cardinal principles of 5 principles framed by Hahnemann, that is law of SIMILIMUM, law of single dose, law of minimum dose, law of least repetition, and law of potency selection. So these cardinal principles helps the physician to find the SIMILIMUM and helps to frame the totality by handling the patients while taking case taking. Similarly, while taking the case, the verbal expression as well as facial expression plays a major role, because in acute symptoms, especially when the patient is in state of almost the vital force is very low, such as extreme viral fevers like dengue or COVID, sometimes with connected with more excess vomiting or diarrhea in gastroenteritis or typhoid fevers, where the vital force will be very much less, where the patient can't able to express more. In fact, the patient gets triggered by our repeated questions. Simply the patient will ignore our questions, and either they remain silent or they will tell that, why doctor, already I am suffering a lot, you are asking too much questions. So not only the verbal expression gives the totality, especially in the acute selection of remedy in the acute condition, it can be connected with acute exacerbation of the chronic illness or actual acute illness like infectious fevers. The facial expression and the bystanders expression about the patient and the ailments from unpqrs symptoms, which highlighted in Hahnemann, Organon, as well as by Bonihausen, helps to frame the totality and helps to find the SIMILIMUM instead of choosing partial similar remedy. Sometimes in one-sided diseases, framing the totality without concomitant like PQRS symptoms or facial expressions creates a lacuna to select the SIMILIMUM. In such cases, these PQRS symptoms, concomitant symptoms, and ailments from with along with facial expression helps to frame the totality as well as choosing the SIMILIMUM. The miasmatic insights plays major role not only in acute illness and also in chronic illness. How the miasmatic insights and miasmatic knowledge helps the physician, in what aspect? Even in acute fevers, by finding out the miasmatic background, either it is connected with psoric fevers or syphilitic fevers. Because psoric fevers, when it is only connected with the indisposition, particularly when the patient already, your old patient who is getting treated for chronic illness, there is no need of remedy until unless that the vital force is very strong. When the vital force becomes very minimal, where the patient lacks the stamina, where the infections or acute illness connected with syphilitic background, there will be the need of the selection of SIMILIMUM by framing the totality. So, the miasmatic background knowledge even in acute illness helps to decide for the physician whether there is a need of remedy or placebo itself enough to treat the patient and to recover the patient. In chronic stages, the understanding of the evaluation of chronic diseases through miasm stands the major thing, because in deep-seated pathology, especially in the latent syphilis state, where the personality choosing constitutional SIMILIMUM should not be based on deep-seated remedies like mineral remedies or metal remedies, where it acts in a more deep-seated, where the patient can't able to tolerate the homeopathic aggravation due to selection of SIMILIMUM with a deep-seated medicine. In that state, the choice of remedy should be based on plant or animal kingdom or the partial similar remedy to bring back the latent syphilitic state, especially in the cancer individual or in state of emergencies, adds more value to choose the, instead of SIMILIMUM, choosing the partial similar remedy. Unless that the patient's vital force recovers back, the patient's stability or the lifespan improved, there you have to do the fresh case taking, considering the background with ailments and the personality judgment along with miasmatic background, where the patient now standing either in the psychotic miasm or in the improved state of syphilitic miasm, there we can choose the exact acute SIMILIMUM. The correlating the modern pathology and microbiology with Hahnemannian concept of the miasm is a holistic view to think about SORA psychotic syphilis. In homeopathy, when considering the psychotic state, where it is difficult for every physician to handle the case with the selection of SIMILIMUM, or to wait for the repetition of the drug, or to wait for the result for the transformation of the miasm, because the psychotic phase always makes and creates the fake picture of the disease individual as if the disease individual have become transformed to the healthy state. Even the blood reports and parameters also tells the fake results, especially in the psychotic state. In such stages, we have to retake the case taking and we have to check out with the verbal expressions, facial expressions, and the bystander symptoms helps to guide whether there is a need of remedy or to wait with the placebos. So, how to navigate the SIMILIMUM and the remedy management? It's not just a symptom match. It's the most similar remedy that matches the entire picture of the individual. It helps in emphasizing the individualization. Individualization is the key to unlock the selection of SIMILIMUM with the proper dosage as well as proper potency selection. According to Hahnemann's organon, we have to consider not, it is very important not only choosing the SIMILIMUM but also choosing the proper potency. For example, in babies and in the children around the age of 5 to 10 years, the choice of acute simillimum or the chronic simillimum should start with 200 potency, where the vital force will be very stronger and very dynamic. Especially in the middle-aged people in the chronic conditions, though it is a exact simillimum, choosing of 30 potency is safer rather than choosing from 200 potency. Especially in the latent syphilis state, choosing of instead of choosing 30 or 200, 5 starting from 5 CH or 9 CH or 15 CH from the low potencies, just increasing in the ascending order to the higher potencies. When the vital force regained completely in the particular individual, helps to choose 30, 200, 1 LM. Sometimes LM plays a major role, especially in the syphilitic state, in an emergency state, where the patient's vital force completely will be lack, and the survival of the fetus will be very challengeable, because the LM is the safest potency where the homeopathic aggravation will be very much minimal and negligible, and also LM potency is very helpful to be repeated in the acute emergencies, in the acute exacerbation of the chronic illness, as well as to repeat it in the water dosage by highly diluting it. Helps more the dilution, more the healing power, according to Avogadro's infinitesimal dose. Sometimes plusing method in acute conditions adds the core value for the triggering of the dynamic vital force to bring back the stability in the particular individual. My first case from a clinical test, that is real world case insights, the acute case, that is gastroenteritis. This was already the case of chronic illness, who is a boy of age around 12 years, who is being treated with me for his autism since 4 years. His mom called me through online last week for that illness. She can't able to express out except physical symptoms, especially the causative factor of the acute illness. She can't able to tell. She simply told that continuous vomiting after coming back from school, with starting of copious vomiting leads to lack of stamina, lying down completely, not speaking anything. Diarrhea also started watery stools. His preferred weather is hot, thirsty, thirst moderate, and that too have the desire of cold drinks. I thought she insisted one thing: the causative factor might be due to intestinal flu from the school. So because of that, I was completely confused what could be the actual choice here. First, I chosen him the remedy of simply thinking that intestinal flu. I gave him arsenicum album, thinking about, because that boy is a foreigner, where the food is provided within the school. In that manner, since the mom can't able to tell what could be the actual picture, I have chosen that particular remedy, arsenicum album, where the boy can't be able to recover back, vomiting stop, but stool still there. Though it is a good symptom in gastroenteritis, where the vomiting completely arrested after selection of the remedy, stool profuse diarrhea is happening, where the body's where the particular boy can't able to bring back his stamina, though given hydrated properly with electrolytes. The next day morning, again she approached me and called me back and told that this could be the added reason, because I can't able to judge exactly. But I can tell one thing: this weekend he is going for the trip individually along with the classmates. That could be the either in the anticipation for the separation from the parents, or this is the first trip going alone, or excitement due to school trip. Whatever could be, this is the only ailments I can able to think of. This is the statement given by the particular mom. After reconsidering the case taking, after I asked her back, now what is the preferred weather and thirst? She said, again, his preferred weather is hot, but not that much cold. Also, extremes, too much of both extremes, he can't able to tolerate it. Along with that, his desire has changed to excess thirst, that too for cold drinks instead of water. By considering these things, framing the totality, I gave him gelsemium 1 dose in water by making her to dissolve 1 pellet in 100 ml water. I asked her to give only 3 teaspoons. That boy immediately improved within 30 minutes to 1 hour in such a beautiful way. That boy regained the strength and started sitting back and asked his mom, Mom, give me some food. This is the beauty of arranging the SIMILIMUM instead of choosing the partial similar remedy. The another case, yesterday, this is also the online case, where she given the history of a sensation of lump in the throat due to ailments from her mom's death continuously for 3 months. Her ailments is simply one thing. Appetite is good, everything is good. Urine good, stool good, preferred weather is uh, again the same way. Too much of extremes, too much hot, can't able to tolerate. Too much of cold, can't able to tolerate. The only thing is she feel something constantly, sensation of lump in the throat. By considering these things, and I added the main thing is that she told me that this could be the added reason. My husband is had the history of myocardial infarction 6 months before. That could be also the anticipation for me. This is the only symptom told by her. I thought that thinking of the silent brooding, she said, I can't tolerate both the extremes. So considering this as a global hysterical state, I gave her Ignitia Amara 200 CH 1 dose, where she didn't, she improved. Her sensation of lump in the throat has improved, but still partially only input, completely can't able to recover back. Again, she approached me in the evening and asked me again, partially improved after ignitia, but still I can't able to improve completely. Considering again, though she expressed her ailments from, I asked her again, how you handle each and everything, how you took over these things, retaking the case history with the mental emotional cause after the death of your mom, how you took that. She said it is a missing feeling, unreplaceable loss. Second thing I asked her, how you took the health happened, the disease, myocardial infarction, in the stage of myocardial infarction happened to your husband, how you took that. That is also, she said, sudden disappointment and almost, I feel that because in this world, I am very close to my mom as well as my husband. After the sudden demise of my mom, though she has illness with the cancer, I can't be able to accept it, and also I feel that I am missing it. And also she added that by thinking about the demise of her own mom, she was again anticipating about her husband illness, that whether he can able to sustain the life due to this sudden myocardial infarction, though he is taking proper treatment, though he was in a stable state. So this added the fuel to choose the SIMILIMUM. Again I asked her, how about your thirst as well as your sleep and your preferred weather? Now she explained that I can't able to feel the thirst, though I feel The lump in the throat, though I feel the dryness of the mouth and throat, I can't able to drink properly because I don't know. I can't able to feel the thirst. The desire of the thirst is not there, though I have the dryness of the throat as well as lump in the throat. Again, I added and asked her that with the preferred weather of two extremes, I gave her an example of this is the temperature of 40 degrees Celsius, whether you can manage, on 15 degree or 10 degrees Celsius you can manage. She simply told me that again 10 degree I can able to manage, but 40 degree or 30 degree I can't able to manage. This added again choosing the right SIMILIMUM, thinking that though she can't able to tolerate both the extremes, she want to tell that predominant towards the heart thermal. Considering these symptoms, I gave her Pulsatla 1M, where she beautifully responded to the SIMILIMUM within 1 hour of the medicine. Again in the water dosage with 3 teaspoons, she beautifully responded completely. The lump sensation has gone completely. Even the mental emotions, she can able to feel the positivity and she can able to handle her husband illness. This is the outcome of the beauty of rapid gentle healing highlighted by the Hahnemann in first aphorism. This is an exact example for ideal cure. This is a chronic illness case from my clinical desk. This is the alopecia totalis case where this male patient approached me. The beauty is that he doesn't approach me for his treating of his scalp. He approached me for atopic dermatitis and irritable bowel syndrome. This is the symptom he want to be uh, recovered back through homeopathy. The beauty of the SIMILIMUM, when it is chosen in a proper potency, proper dosage and proper SIMILIMUM, adds the more value even in autoimmune disorder like alopecia totalis, helps to recover back and helps to do wonders and miracles as if the single pellet acts as a magic pellet. Here, he narrated with the symptoms of irritable bowel syndrome, especially immediately after eating, he will pass stool. That too, semi-solid stool without any pain or without any change of consistency of stool or any undigested food materials will be seen in stool. His thermal is preferred weather is hot. He is extreme thirsty. He is an engineer. He is very highly intellectual. He is an introvert personality where he gives more importance towards the passionate towards his own job as he is working in the R&D sector in the mechanical engineering side. Even he forgets about the time space with the family. That much passionate within his work, whatever he is doing, irrespective of thinking about his own food. Sometimes he miss his meal, he miss his sleep. His desire towards the craving for sour and salty foods. This is the craving for him, especially he craves for non-veg, most probably with fish rather than choosing meat. Fatty foods always disagrees. That's why he always tries to avoid meat as well as chicken. This, as he is already suffering with irritable bowel syndrome, this fatty food triggers his frequent stools into almost like a diarrhea state. So he tries to avoid because he is very cautious in taking care of his physical health as well as mental health. He always experiences the sweat in palms and soles, that too much And especially whenever he is more anxious, whenever he is more nervous, whenever he is overthinking, his sweat to in his palm almost will be like drenching. If he uses some handkerchief, the handkerchief completely drenched with the sweat. If he squeezed the kerchief, the sweat will falls down. That much too much of drenching in the both palms. He is more emotionally reserved. It is not in the sense of introvert. He wants no one to be justified. No one should find who he is. That's why he gives more importance to the justification and opinion about how he was judged by others. He always have the aversion towards the animals, yet he has the empathy towards animals. He always gives food to the animals. He always just admire far distance animals. He doesn't want to touch the animals, or he doesn't want to keep the animals nearby. He never allows his kids to keep the pet animals inside the house rather than making the pet animals to stay in the balcony or in the lawn. It shows that he has the aversion to the animals, not with the fear or not with the aversion connected with the animals. It is connected with the fastidiousness, wants to need of cleanliness. The need of cleanliness, because animals always will be very messy and always have the stinky odor. So because of that, he wants to avoid the animals. Fastidiousness in the habits, not only in the physical plane but also in the mental plane. He will be very cautious in using the words. He is very dignified in his mannerism. He never shout out of temper, even with family members or even with the outsiders. Such humble, dignified personality, talks very less, calculative in spending money. Though he loves ambience and luxury, he is very calculative in spending, not too much spending nature. His suppressed grief starts from the mother's illness, where she was bedridden for many years, with with the pathology of cancer, leads to the emotional disturbance in the son, because he can't able to take care of his mother in his own house. His sibling only taking care of his own mother, because due to his over bounding duty responsibility, as well as his wife also working person, his both kids are studying in college, so no one is adding responsibility to take care of her mother. So whenever time permits, he will go and visit the mom and spend the time with his mom. So the suppressed emotions and the guilty sensation because of not taking care of his own mom, though he has the responsibility to take care of his own mom. His mom has not having any regrets towards his nature, because she knows that her son is more passionate towards the work. Considering these totality of symptoms, I have chosen Natramur 30 CH. After 4 months, I repeated Natramur 200. After 3 months, I repeated Natramur 1 1 dose. Out of 6 months to 8 months, he beautifully responded with the new hair growth. Even his mental emotions has improved. His irritable bowel syndrome almost completely normal. The remaining symptom around 8 months is skin. As we all know that According to Herring's law of cure, always the outward reflection of the disease should be treated the least rather than first treating the inward reflection of the disease is very important. It shows that the natremure is the exact simillimum where the autoimmune disorder like alopecia totalis get corrected and rectified by the proper selection of remedy as well as proper selection of potency with the repetition. With the natremure LM, within the period of 3 months to 4 months, he again beautifully responded to his atopic dermatitis also. Itching has drastically reduced and the redness and the flare-up of symptoms along with peeling of the skin also reduced drastically. According to Hahnemann's organon, in the aphorism from 246 to 250 in the 6th edition of organon, where Hahnemann has given the guidelines with the practical insights in selection of potency as well as repetition of the dosage, both in acute and chronic management. So, choosing the SIMILIMUM stands with the mastering the case analysis with the path to the SIMILIMUM. Organon is a living document relevant to the modern practice, irrespective of any diseases or any stage connected with the miasms. It always stands as a, in fact, Organon is a Bible of homeopathy, though mathematical knowledge gives added knowledge to the selection of SIMILIMUM. Whenever we are selecting a remedy, whenever we are choosing a potency or dosage according to posology, we have to consider the main thing is that the patients who are very discontented always tries to project out the case as if they are not at all better. They always simply come and tell us that, doctor, whatever the remedy you are giving, I am not responding to the remedy. I feel standstill. Such a patient, we have to be very careful that what is happened exactly. It is an actual state of the disease expressed by the particular individual, or it is the state of the personality connected with the discontented feeling. That is unsatisfactory. Though the expression of the symptoms by the patient and the verbal expression plays a major role in framing the totality, we should be very cautious that whether the person is telling exactly true or he wants to create a mess in selection of SIMILIMUM or potency because of the unsatisfactory character. So, the understanding the suppression and the setbacks again plays the major role in second prescription as well as repetition of the dose with proper selection of the potency. Recognizing the suppression in terms of current medical practices and its impact on the case, it is very important. For example, a patient who is having complex diseases in the form of dissimilar phenomenon. For example, a patient experiencing with the history of symptoms, uncontrolled diabetes along with eczema or cellulitis, where the diabetes coming under control, but the cellulitis or eczema is not improving means it is not setback or suppression. It is the actual way of Herring's law of cure where the diabetes blood sugar levels should come controlled. This is the real indication of selection of SIMILIMUM. Though the patient tells that because of the suffering of the cellulitis or because of the suffering of the eczema due to intolerable burning or itching, you should not think that what we have chosen the remedy is exactly SIMILIMUM or partial similar remedy. So the suppression should be ruled out only by the physician, not by the patient. Then only we can able to handle the particular case with proper dosage and proper potency, whether the patient is in the actual need of repetitions. How to handle the complications or accessory symptoms that arise during treatment. For example, if a patient coming to us with bronchial history of bronchial asthma, where we have started the treatment for them for the wheezing, to reduce the episodes of wheezing and to reduce the intensity of the wheezing, where the patient always using the homeopathic medicine as well as using the puff, where we can't able to see the exact actual result. That's why we have to guide that particular patient is that until unless then there is a need of puff, try to reduce the usage of puff as well as usage frequency of puff usage in your life. Try to handle along with homeopathy. Sometimes too much use of puff, especially for a long standing for many years, add more pathology with the side effects of chronic bloating or gasping of breathing. Sometimes it adds the collection of fluids in the face as well as generalized edema. So the accessory symptoms created by the particular medicine or accessory symptoms created by use of other system of medicine should be ruled out to find out whether the choice of selection is right or wrong, whether the suppression is happening or the healing is happening, which is very, very important. Similarly, again a case of chronic sinusitis or migraine, we are treating it. In between, the patient experiencing continuous sneezing or the headache came to control, sinusitis came to control, the nose block completely relieved, the smell recovered, taste recovered, but still the patient is experiencing the early morning continuous sneezing with irresistible watery nose. This again indicates that the patient is in a proper healing progress where the sinusitis control, where the disease transformed from the syphilitic or psychotic layer, where the smell blocked completely, taste blocked completely, has recovered back, indicates the soric stage of the disease, where we can wait with placebos. It indicates the sinusitis state transformed to rhinitis state, where the stage of the miasm is very important here to find out placebo is enough or repetition of needed or change of potency or change of medicine is needed. This is the beauty of homeopathy, where we can able to choose the remedy selection with the proper dosage as well as proper potency when we are acquired more knowledge in the organon, because organon and materia medica is like a both eyes. We can't say for a human being one eye is important and another eye is unimportant. Both eyes are very important. Similarly, in homeopathy, irrespective of using repertory or irrespective of using materia medica, organon is the base for framing the totality. Organon is the guidance to frame the case taking. It helps to navigate the exact SIMILIMUM, helps to choose the exact SIMILIMUM with the proper understanding and knowledge of inner core of each remedy from the materia medica standpoint. The holistic approach plays a vital role in homeopathy, which is very, very important, which do magic and wonders in the field of homeopathy. Thank you all for the wonderful opportunity. Thank you again for each and every viewers here who patiently hear my lecture.
Thank you, Dr. Bhuvaneshwari. Ma'am, is there anyone who would like to ask any questions to ma'am? Or is there anyone who would like to interact with her?
Yes. Yes, Dr. Bhuvaneshwari, it was really an excellent session and you covered almost the philosophical part, why a homeopath need to study all those things and how important the knowledge of organon of medicine in getting success in each and every case. That's the reason why you are able to produce such a brilliant session in this evening. And as you rightly point out, the case taking is important. Converting the symptoms into rubric is also important, and then going the knowledge of miasms as well as the knowledge of potency and how to repeat, when to repeat, and what to do when the patient come after the first consultation. And anyway, it was really an excellent session. We really appreciate your effort in coming up with such a session with the scientific evidence. This is what we call as the real evidence. That is why we used to say that evidence-based homeopathy is the need of the hour to prove the world that homeopathy is scientific and this is a modern science.
Thank you, sir.
Yes.
Questions?
Thank you, Dr. Bhuvaneshwari. And I think you mentioned on point that only the physician can interpret whether it's a palliation or a cure. It's the most important thing, and no other laboratories can find it. Only the judgment of the physician is more important. And moreover, in such cases, the diet and regimen is so very important. That should be observed because what Hanuman said, or what are the instructions given by him, is getting after a lot of experience and experiments. Not a single suggestion given by Hanuman without experience or experience. Prove everything, hold fast which seems good. That is policy. That is why homeopathy still remains and still gains momentum. So what is needed is that more education, academic qualifications are more important. We don't have the specialty courses. We don't have super specialty course. 1990 when we have started degree course, the post-graduation course, after 34 years, took 34 years to start to think about the this DM courses. That means around 30 batches lost their opportunity to study more. So only a system with that much formal academic education will be accepted in an educated society. Unfortunately, we forget that. Then again, what is more needed is combined efforts. Now, what happens is that only single persons here and there practicing very good practice, they are getting practice. That is not at all enough in this world. We need institutions. And the next session, the Malayalam session, kindly we must listen. We have a session on a hospital in Alappuzha district, Kerala, by Dr. Madhusudan sir. He started a hospital there. So similar ventures are needed. And anyway, congratulations for the president. Thank you.
Thank you, sir.
Thank you, sir.
Yes. Ramparesh, I want to speak. Yes.
Thank you, Dr. Dhanesh and Dr. Manoj sir. Congratulations, Dr. Bhuvaneshwari madam.
Thank you,
Very
sir.
nice, excellent session. Very good explanation of organon of medicine. And without organon of medicine, homeopathic not practice, real practice. Curative based practice, not curative based practice. Palliative based practice and suppurative based practice. Organon, requisite qualification of physician. Knowledge of disease, knowledge of organon, knowledge of materia medica, knowledge of physiology, knowledge of anatomy, etc. Fully describe the Mahatma Hanuman organon important base of practice. Very, very thanks, Bhuvaneswari Madam. Thank you.
Thank you, sir. Thank you.
There's an announcement for tomorrow. Tomorrow we will have a session from Dr. Shishir. He is the professor at Charida Krishna Homeopathic Medical College, and we'll be talking about pediatric thyroid problems and management with homeopathy. Over to Ms. Arya.
Thank you, sir. With that, we'd like to conclude today's session. I thank our guest, Dr. Bhuvaneswari ma'am, for such an enlightening session. And I also thank all those who have participated in this webinar. And a general reminder, if you have missed any of our webinars, there's a live recording and free videos available on our YouTube channel of IFPH Talks. And thanking all of you once again. Good evening.